Hi everybody, welcome back to UWorld's Next Gen NCLEX review session. My name is Jackie and I'm a nurse here at UWorld. We're so glad to have you guys with us today. We're going to be doing a question drill set focused on pharmacology questions. So we are going to cover tons of different medications, things you need to know, and walk through some different test taking strategies for this. So what you guys can expect is I will read the question to you, read you the options, give you about 30 seconds to answer, and then we will walk through why the correct answer is right. If you guys have any questions along the way, make sure you use that chat. Nurse Samantha is moderating today, so we will answer your questions the very best that we can. With that being said, let's go ahead and get started. All right, our first question says, the nurse has had a client with hypertension who has a new prescription for Ramipril. Which of the following statements by the client would require follow-up? Option 1, I should discontinue the medication if I develop swelling of my lips or eyes. Option 2, I will avoid taking a potassium supplement with the medication. Option 3, I can continue taking the medication if I become pregnant. Option 4, I may develop a dry cough while taking the medication. All right, thanks for putting your answers in the chat. And again, welcome everybody. We're so glad to have you here. We are live on all of our channels. So hello to everybody. For all of you guys on TikTok, make sure you share this session. The more the merrier. Make sure you're following us on your favorite channel. We have lots of great new content headed your way, especially as you guys are getting ready to kick off nursing school again. So we are glad to have all of you here, and I love seeing the chat getting going and seeing so many of you guys on here today. So we're glad to have you here. Welcome, welcome. Happy Wednesday, middle of the week. All right, I'll give you guys about 10 more seconds to answer, and then we will go from there. All right, and good answers. You guys are doing great. I'm seeing a lot of good answers, and good job for some extra information about why you're picking the right answer. Good work, you guys. Awesome, awesome. Okay. Let's pull up our correct answer. So our correct answer on this one is going to be option 3. Okay, so what we're seeing, again, just starting at the beginning of this question, we're going to see would require follow-up. So requires follow-up means that what's going on here, what the client is saying, it's not going to be safe for the client. It's going to be contraindicated. We need to intervene, essentially. So that's what we're seeing with option 3. So Ramipril is an ACE inhibitor. So ACE stands for angiotensin converting enzyme inhibitor. So essentially what this is going to do is promote vasodilation, and that's going to decrease our aldosterone and also lower our blood pressure. So that's kind of the therapeutic effect of what we're looking for with Ramipril, with ACE inhibitors in general. But this medication is not safe to be taking while you're pregnant. You need to notify your healthcare provider, try a different medication for hypertension. It's not going to be safe. So again, you guys did great. I think I saw pretty much 100% accuracy on that one. So well done, well done. Oh, and I'm seeing congratulations to our viewer on YouTube that just passed your NCLEX last week. That's amazing. A huge congratulations. Make sure you guys let us know too if you've passed. We're glad to have y'all here. Okay. So again, what you guys are seeing in option 1, these are expected findings or some side effects of ACE inhibitors. So angioedema, we need to notify the healthcare provider. We need to discontinue that medication. We're going to worry about in option 2, we should avoid potassium. This medication can increase our potassium, so we don't want to double increase it. We worry when we have too much potassium about dysrhythmias with our heart. And then option 4, dry cough. Again, this is something we can expect. It can be self-limiting. So again, it's all about managing those side effects and knowing what's safe for our clients. So good work, you guys. Good answers. Awesome, awesome. Okay. Moving on, question 2. The nurse is caring for a client who is receiving sertraline. It would require it would require follow-up if the client reports option 1, drowsiness and fatigue, option 2, diaphoresis and fever, option 3, decreased libido, option 4, weight gain. All right, drop those answers in the chat. Let us know what you think. 30 seconds on the clock. Good answers, you guys. Good work. And so great to see so many of you guys on TikTok here today. We love to see all of this interaction in the chat. So make sure you guys are putting those answers in there and let us know if you have any questions. And good luck to everyone who's getting ready to test. Let us know too. Are you guys kind of kicking off nursing school again? Are you getting ready to take your test? Are you working and just here for fun and question practice? We love to know all of that. Awesome work, you guys. All right, I'll give you guys about 5 more seconds. A bunch of great answers coming through. Well done. Oh, last semester. Good luck. That's amazing. That's fun. You get to do a lot of clinicals and fun classes that really put all of your learning together. So good work. Cool. Okay. All right. So our correct answer on this one is going to be option 2, diaphoresis and fever. So again, requires follow-up. It's going to mean that the finding is concerning. It's not expected. It can indicate a complication. So that's what we're seeing with option 2. So sertraline is an SSRI medication, and a complication of these medications is serotonin syndrome. So serotonin syndrome or serotonin toxicity, it's an autonomic hyperactivity. So think about hypertension, hyperthermia, tachycardia, and diarrhea, and it can be life-threatening. So what happens is we have excess serotonin in the central nervous system. So this can occur anytime a client starts a serotonin-containing medication or makes a change in that dosage. So again, it's typically going to resolve after that medication is discontinued, but we really need to monitor these clients, make sure they're stable, make sure they're safe, and provide supportive measures however we can. So if we're seeing diaphoresis and fever, those are again all signs of that kind of hyperactivity of our bodies. So we're going to worry about that. We're going to report it. We're going to have to notify the healthcare provider and discontinue that medication. All right, you guys did great on that one. Well done, everybody. All right, moving right along. Question 3. The nurse is caring for a client who is receiving IV vancomycin through a peripheral venous access device. Which of the following actions should the nurse take? Select all that apply. Option 1, instruct the client to report any hearing changes. Option 2, monitor the VAD or venous access device insertion site frequently for erythema and swelling. Option 3, use an infusion pump to administer the medication over 20 minutes. Option 4, check the client's serum creatinine level prior to administering the medication. Option 5, obtain a serum trough level after administering a scheduled dose of the medication. All right, 30 seconds on the clock. Drop those answers in the chat. Again, it's select all that apply, so you're going to have more than one right answer. Take your time, read what the question's saying, especially what the question's actually asking. So it's what should we do? So when we see that, we're looking for our safe interventions. All right, and again, thanks to everybody who is sharing this session. Make sure you're following us. Again, we have a lot of great content coming your way, but we want to reach as many of you guys as possible, grow our UWorld nursing community. We're happy to have you all here, so we want your friends to be here with us as well. All right, good work, you guys. Awesome, awesome. All right, let's see what we got. I will pull up those answers. Okay, so our correct answers on this one are going to be 1, 2, and 4. So again, just a kind of test-taking strategy, what you can apply to these select all that apply questions is a true-false approach. So true-false to what the question is asking. So for option 1, is this something a nurse should do or something a client should do? So that's what we're seeing here. So vancomycin, just in broad terms, is an antibiotic. It's used to treat gram-positive bacteria. So kind of think about like your staph infections. Clients receiving it, though, they need a lot of close monitoring. So we're definitely, vancomycin can be ototoxic, so toxic to our hearing. So if our client is experiencing any hearing changes, like what we're seeing in option 1, they need to report it. That dose might not be therapeutic to the client, might be too high. They might need to try a different antibiotic. Option 2, monitor the insertion site. So again, it's also can be a, I'm losing it. it's a vesicant. Sorry, I lost my word. So it can cause extravasation or like kind of like some phlebitis around that insertion site. So we want to make sure that the integrity of that vessel is maintained. We want to make sure that it's in the line flushes before we administer it. There's no complications because again, if that medication seeps out outside of the vessel, it can cause a lot of pain and discomfort to the client. And then option 4, again, this can be nephrotoxic. We want to make sure that if we're giving this medication to a client, their kidneys can filter it appropriately. We don't want it to be building up in their blood and causing toxicity. So we definitely want to make sure that their kidneys can handle it. And if there is some kidney impairment, that we dose adjust for that we're giving them something that they can handle. You guys did great on that. I did see a good bit of number 3s. So we definitely want to slow the administration of vancomycin. It should not be given as a rapid infusion. It should be at least 60 minutes. So we definitely don't want to like bolus vancomycin. And then option 5, I don't think I saw too many of those, but again, whenever we're collecting a trough medication, we want to do that before we give a medication. So we want to know like when the medication's not actively being circulated, what that level is in the blood. So good work, you guys. Well done, well done. Okay. So question 4, the nurse is caring for a client with a new mechanical heart valve. The nurse should expect that the client will be prescribed option 1, warfarin, option 2, dabigatran, option 3, tacrolimus, and option 4, apixaban. I really only said option 1 and option 4. Great. So I apologize for that. Awesome. Let's see what you guys think. Oh, great answers coming in, you guys. Good work on TikToks. So good to see you, so many of you guys again here with us today. And let us know if you guys joined on Tuesday. Like, are we part of your daily live schedule? And we'd love to know that too. All right. Put those answers in the chat. Let us know. Good work, you guys. Awesome, awesome. And make sure you come back tomorrow at 3 p.m. Central. We will also have another live session. So we're looking forward to that. All right. Oh, thank you for saving us in your calendar for alerts. That's great. All right, so our correct answer on this one is going to be option 4, warfarin. Okay, so talking about, this question, it's pretty self-explanatory. We're looking for the medication that a client with a mechanical heart valve we would expect them to be on. So that's definitely warfarin in this situation. So, we're kind of thinking about the long-term maintenance of mechanical heart valves and what we're going to expect for that. So warfarin is an anticoagulant. We're going to give it to clients with a mechanical heart valve because of that risk of kind of platelet aggregation on the valve itself. So one of the things that's great about mechanical heart valves is they last a long time, but one of the disadvantages is that they have a little bit higher propensity for that platelet aggregation or that clot formation. So these clients are going to require that lifelong anticoagulation. So you guys did great on that one. I think I saw 100% accuracy. So well done, you guys. These are... So I saw some questions about apixaban and dabigatran. So for apixaban, these are given for like clot prevention or thromboembolism prevention, but they're not approved for valves typically. So we're going to default to warfarin in this situation. And then again, option 4, apixaban, this is contraindicated for valves. So we're going to stick with warfarin. That's going to be our go-to. Good work, you guys. All right, past the halfway mark, question 5. The nurse has taught the spouse of a client with hepatic encephalopathy who is receiving lactulose. Which of the following statements by the client's spouse would indicate a correct understanding of the teaching? Option 1, the medication may cause constipation. Option 2, the medication is administered as an injection. Option 3, the medication will improve my spouse's confusion. Option 4, the medication will decrease my spouse's liver enzyme levels. All right, drop those answers in the chat. 30 seconds on the clock. Let's see what you guys think. A bunch of great answers coming through. Good work, everybody. And we'd love to know too, after you answer, let us know where you're joining us from. We love to see where you guys are all around the world. If you're here in the States, outside, all of that, let us know. All right. Awesome answers. Oh, wow. We have Florida, Kenya, Nairobi, Amazing. That's so cool. We're glad to have you guys with us. Ghana. Cool, cool, cool. Virginia, Nepal. Wow, that's pretty neat. Everyone's from all over. That's so cool. All right. Okay, I'll give you guys about 5 more seconds and then we will pull up our right answer. So good work, you guys. All right. Our correct answer on this one is going to be option 3. So again, we are looking for correct understanding means that what we're reading is a true statement. So of these options, which one is accurately describing like the therapeutic effect of lactulose? So in order to kind of understand how lactulose works, we need to understand hepatic encephalopathy. So hepatic encephalopathy, and bleh. You would think it's a Thursday, but it's really a Wednesday. Okay, hepatic encephalopathy is a complication of cirrhosis. So again, it's going to cause, or it's going to happen from a buildup of ammonia in the blood. So again, the liver is going to be unable to convert that ammonia into urea to be eliminated by the kidneys. So this is really where lactulose comes in. It's going to help kind of pull that ammonia out, and in turn, it's going to improve our symptoms from the encephalopathy. So what you can kind of expect for a client that has hepatic encephalopathy, just think about, like a toxic substance in our brain. So we're going to have lethargy, some confusion, slurred speech, and it can even progress to coma. So again, that lactulose is going to pull that ammonia out and it's going to get rid of it through our GI system. So, we're going to expect like a looser stool consistency. But again, it's going to improve those symptoms. It's not going to change anything about how our liver is functioning. It's just managing the symptoms that are being caused by our liver dysfunction in cirrhosis. So again, what we're seeing in option 1, it's going to be the opposite of constipation. They're going to have a lot of stool and it'll be loose. Option 2, it's not an injection. It's a liquid. We're going to drink it, or it can even be given as an enema. And then option 4, it's not going to change anything with our liver enzymes. So you guys did great. Well done on that one. Okay. Question 6. The nurse is teaching a client how to self-administer enoxaparin. Which of the following statements by the client would require follow-up? Option 1, the needle should be inserted at a 90-degree angle. Option 2, I will gently pinch the skin at the injection site before administration. Option 3, the injection site should be at least 2 inches away from my umbilicus. Option 4, I should expel the air bubble in the syringe before administering the injection. All right, good answers, you guys. Drop those answers in the chat. 30 seconds on the clock. Good work. And I want to know, I feel like enoxaparin, this is also Lovenox, is like one of your first medications you give whenever you're doing like a clinical rotation. So let us know if you've ever given enoxaparin. Definitely something you will give no matter where you work in a hospital, no matter what floor you're on. So good work, you guys. All right. Awesome. Let's see what we got. All right. So our correct answer on this one is going to be option 4. So we want to keep that air bubble in. So whenever you're giving enoxaparin, you're going to inject it, and that air bubble is going to be the last thing that goes in, and it's going to seal that medication under the skin. So good job, you guys. You did awesome on that one. Well done. Well done. Okay, moving on, question 7. The nurse is preparing to administer digoxin to a client. Which of the following findings would require follow-up prior to administering the medication? Option 1, heart rate of 56 per minute. Option 2, temperature of 99.1 Fahrenheit, 37.3 Celsius. Option 3, respiratory rate of 22 per minute. Option 4, blood pressure of 90/48 millimeters per well, just don't worry about that. Blood pressure of 90/48. All right, let's see what you guys think. I'm seeing a good mix of answers on here, so we can cover this, but good work, you guys. Digoxin is also a common medication that you'll see too, but it definitely has some different safeties that, like, whenever you get into a hospital and you're dealing more with like an electronic health record, there's some kind of safety alerts that'll pop up whenever you give digoxin. So let us know what you guys think. All right, good work, you guys. And again, before we're done, if you guys have any requests for topics, either for us to talk about on our Tuesday lectures with Samantha or Wednesday and Thursday for question drills, let us know. We're always building our calendar. We love to kind of hear from you guys what is maybe most challenging for you guys, what you want to hear more of. If it's like more pharmacology questions, covering more meds, anything like that, we love to hear it. So good work, you guys. All right, so our correct answer on this one is going to be option 1, a heart rate of 56 per minute. So again, our question says requires follow-up. So we're looking for the finding that is going to cause us to not give the medication. It's going to be like a hard stop for the medication. And so that's what we see with option 1, a heart rate less than 60. So digoxin is a medication we give typically for clients in heart failure. It's going to help with that myocardial contraction or that squeeze of our heart muscle. So that's in turn going to increase our cardiac output and improve that circulation and perfusion. So DIG has like a pretty narrow safety window in clients. So it requires a lot of monitoring. So if it builds up too much in our system, we can have a decreased heart rate. So we definitely need to monitor that and make sure we're giving it safely. So option 1, a heart rate less than 60 is going to be a stop for digoxin. We're not going to give it if our heart rate's under 60 because it can further worsen that and bring it down even lower. But you guys did great. I think I saw like 100% correct answers. So well done, well done. I did see a couple option 4s. So we're not going to worry about our blood pressure as much in these clients. And a lot of times in heart failure, we want our clients to have a low blood pressure. We want the heart to not have to work as hard to get that blood out. So, our parameters might be a little bit different, but again, it's definitely something to monitor, but not anything we're going to be concerned about for giving DIG. So good work. All right, last question. The nurse is preparing to administer an IV infusion of norepinephrine to a client. Which of the following actions should the nurse take? Option 1, insert an indwelling urinary catheter. Option 2, obtain the client's blood pressure every 4 hours. Option 3, place the client on continuous cardiac monitoring. Option 4, administer the medication as a secondary IV infusion. All right, 30 seconds on the clock. Drop those answers in the chat. Again, before we're done today, make sure you come back tomorrow at 3 p.m. Central. We are going to be covering prioritization questions, not prioritization questions, effective teaching questions, but we've got a great lineup for you guys. So come back 3 p.m. Central Time on your favorite channel, and we will go through these questions again and get you lots of practice, especially for those of you getting ready to take your test. This is a good refresher on anything. So very good, you guys, and great answers. Y'all are doing awesome. All right, so our correct answer on this one is going to be option 3, place the client on continuous cardiac monitoring. Okay, so norepinephrine, this is like Levophed, so it's a pressor. You can kind of think about it as like pressing down on our blood vessels or vasoconstricting. So we're gonna give this in situations where we're not having like good perfusion to our organs. So think about like sepsis. We're gonna give clients a lot of times Levophed in this situation, or norepinephrine. So again, it's going to help increase our heart rate. It's going to get blood pumping more effectively. So anytime we're giving a medication like this, we need to make sure that the heart is, we're monitoring the heart. We're looking for any dysrhythmias. It's definitely going to, affect the heart. So we need to make sure the heart's tolerating it and manage anything that can make us hemodynamically unstable. And again, if we're giving Levophed, we are hemodynamically unstable. So this client definitely needs to be on cardiac monitoring. Some of like a kind of a unique thing about this question, like these are all things that we should do for this client when they're on this medication, but we're thinking of like the one thing that we need to prioritize. So again, think about those ABCs. Like if you're having to pick something, we definitely need to make sure that like ABCs are being addressed. So again, like this is a C, we're going to worry about that. And we're going to worry about that over option 4, which would be like safety. So again, we prioritize their ABCs, then infection and safety. So I hope that's helpful, but you guys did great. Let us know how many you got right out of 8. And as always, make sure you guys check us out on nursing.uworld.com. We have tons of great resources to get you ready for nursing school for your NCLEX, and also just to be able to learn more about who we are as a company. If you haven't checked us out, make sure you try our free 7-day trial. You can see tons of questions, NGN case studies, NGN type items as well. So be sure and check us out. Come back tomorrow, 3 p.m. Central Time, and have a great evening. Talk to you later. Bye.